Sagar Lonial, Professor and Chair, Department of Hematology and Medical Oncology, Chief Medical Officer, Winship Cancer Institute of Emory University. So I think there's a lot of really exciting topics that are going to be discussed at the meeting this year, and many of them include probably the big three categories in cancer across the board, and that is targeted therapies based on specific mutations. We know that that's becoming a big deal in the acute leukemias as well as in lymphomas. The second is immune-based therapies, whether it's checkpoint blockade or second-generation checkpoint blockade approaches. And the third is cellular therapies, the use of things like CAR T cells or antigen-specific T cells that I think are really going to change the way we treat blood cancers. So I think one of the unique factors of this meeting specifically is the fact that the faculty are very, very well known, and so you're getting top-of-the-minute, most up-date data from highly respected faculty from across the country, and in some cases across the world. I think the second piece is that there are a number of settings outside of the lecture hall that allow you as the practicing physician to interact with some of these thought leaders and get their input on specific cases and perhaps set up a dialogue that might help you to care for your patients over time. The third is that one of the things we've asked the faculty to do is really focus on practical aspects of taking care of patients day to day. Many of us have been in lectures where we've heard lots of basic science and seen lots of mouse experiments. This is really all geared towards how do you get better at taking care of your patients. So I think that from a nursing and supportive care perspective, as we've grown the number of new therapeutic options, managing compliance as well as adverse events becomes even more challenging as well. And for those of us who practice and take care of patients every day, we know that the docs don't do that. It's the nurses that really are on the front line of helping to keep patients on therapy so that they can ultimately get their benefit. And that is one of the focuses that I think will be addressed in the nursing-specific symposiums: how to ensure compliance, how to ensure understanding, and how to manage side effects with the new drugs. So, I think one of the real challenges, particularly in myeloma, is that the pace of change is so fast. We've had 5 randomized phase 3 trials that all show that 3 drugs are better than 2, and all 5 of those are with different drugs. And so as a day-to-day oncologist, how do you choose what to do and when to do what? And I think trying to understand how to optimally treat your patient without exposing them to the risk of adverse events and toxicity and lack of response is really one of the challenges that meetings like this try and address. Well, I think, last year we saw a taste of the immunotherapy impact on blood cancers. I think we're going to see an even bigger exposure to that as we go forward, whether it's the use of PD-1 inhibitors or CAR T cells. And I also think with each passing year, we learn more about how to use the drugs that we currently have. And as an example, at ASH this year, we saw data that said the EPOCH regimen for lymphoma is just as good as R-CHOP. Well, that's something that I think is important, and that we understand how to change our therapy based on new phase 3 data like that trial. So again, with so many changes coming in the field of how to take care of patients with blood cancers, I think CME represents one of the best unbiased approaches for doctors to get data. And we know that rather than having an individual company come into their office and tell them about their specific drug, having somebody who's used them all, understands the data, help guide an individual oncologist in their practice really represents the real strength of CME.